Blemishes, spots, pimples, bumps. There are so many words when it comes to describing acne. It can be a little bit confusing. Welcome back to the Acne channel. Today we are talking about the 6 different types of acne so that you know exactly what form they come in, what they look like, how to best treat them so that you can love the skin that you're in. There are essentially 2 categories when it comes to acne. The first is inflammatory and the second is non-inflammatory. Non-inflammatory acne is basically your whiteheads and your blackheads. This is where the body has not identified it as an infection, so it just kind of sits there underneath the skin. The good news about non-inflammatory acne is that it is really easy to treat. The second category is inflammatory acne. This includes papules, pustules, nodules, and cystic acne. This can be really painful, looking really red and inflamed on the skin. This tends to be harder to treat, but it is not impossible. So let's focus on each. So with the first type of non-inflammatory acne, we have whiteheads. When it comes to whiteheads, it's a closed comedone. That means that it sits just above the hair follicle beneath the skin. It's embedded without having any opening. There are 2 main solutions for this that you can try at home. The first is salicylic acid. This essentially dissolves the cement that holds the sticky cells together. The second is benzoyl peroxide. Something at 2.5% is sufficient. If anyone tells you to go for 10%, that is way too much, as this could dry or irritate the skin. Moving on to the second type of non-inflammatory acne, these are blackheads. Now, the reason why they appear black is because the top part is oxidized. These can typically be seen on the nose, within the pores, sometimes on the chin, or different parts of the body. My best suggestion with this is simply over-the-counter products. You don't need anything that's prescribed. I would steer clear from harsh exfoliants. This comes in the form of apricot scrubs or walnut scrubs, just something more gentle. You can even use the salicylic acid or benzoyl peroxide to help with this, so more of a chemical exfoliant rather than the physical, as not to further damage the skin. So chemical exfoliants can really help to gently unclog pores and dead skin cells. I definitely do not recommend using pore strips. Pore strips are a band-aid solution. It's a very short-term solution. What this does is it not only rips potentially the blackheads, but also the skin above it. This can tell the body that it needs more oils because it's stripping the natural oils. So then your oil glands go into overdrive, producing even more oil, potentially clogging your pores yet again, if not even more. And then you have to go through the entire cycle again. So definitely go for the chemical exfoliants or gentle exfoliants. Moving on to inflammatory acne. Papules, pustules, nodules, and cystic acne. Starting with papules. So papules basically appear red. This can be quite painful. There's no pus inside, but these are these larger red bumps. There's bacteria on the outside of the skin. So your salicylic acid can be your best friend, really helping to kill that bacteria. Benzoyl peroxide can help externally and internally. You just want to be nourishing your body and flush toxins out of your body naturally. So antioxidants are great, whether it's having fruit like blueberries, blackberries, really high in antioxidants, staying hydrated again to help flush the body and to help calm the inflammation. Next are your pustules. Now, these look similar to your papules, but they have pus in them, hence the name pustules. This can appear in clusters on the skin, whether it's on your face or your chest or your back. You can use the same over-the-counter methods like salicylic acid, benzoyl peroxide, nourishing from the inside, flushing the body of toxins, being patient with your body. And some doctors and dermatologists might recommend using birth control or antibiotics. I would steer clear from this, as this can cause imbalance with the hormones or wreck my gut in the process, or experience all of these other side effects. There's a whole list that you can check out when looking at different antibiotics or birth control. So I would recommend steering clear and really nourishing from the inside out and trying out those over-the-counter methods. The third type of inflammatory acne is your nodular acne. This can appear as flesh-colored or red bumps. These are deep within the tissues, so do not pop them because they don't have a head and will cause more damage to your tissues. So I know that it can be really challenging, especially when it's really sore and you can feel it deep in the skin. But if you continue to practice having a simple regimen for your skincare, adding in the gentle exfoliators or exfoliants that you use, nourishing from the inside out, the skin will actually clear it naturally. The fourth type of inflammatory acne is cystic acne. Dun dun dun! This can be really painful, this type of acne. It is not pleasant at all, but again, it is treatable. These can appear larger in size, and doctors or dermatologists might prescribe steroids as a solution. This is just a long process, and healing is a process. So again, with some of what I mentioned already, along with nourishing and healing, focusing on the gut and healing from the inside and balancing out, if you're a woman, your hormones, even if you're a man, your hormones, and also balancing your gut bacteria, consuming really good probiotics, whether it is in a supplement form, yogurt, fermented drinks like kombucha or even kefir, sauerkraut, pickles. So there you have it. Those are the 6 types of acne, what they look like, and how to best treat them. And so the next time you see a visitor pop up on your face, your chest, your back, wherever it is, remember not to freak out, and that there are ways to heal holistically. It is a holistic, well-rounded solution that is the long-term solution, that is the most sustainable, that is going to support your body and your system along the process. So whatever it is that you have, I hope that you do find the best solution for you. And as hard as it might be, as challenging as it might be, one of the best, absolute best things that is going to help you is truly embracing the journey, and not just the journey, but discovering the things that you love about yourself and your skin and the uniqueness of you in what you're going through. I know that this can be hard, but seeing this as a positive, the character that is built through this journey is really worthwhile. I've been there, my friend, and I know that you are going to get through this. So I hope and trust that this has been helpful, and I'll see you next time.